unsustainable pressure on the NHS. Let's talk to Dr. Raghib Ali, a senior clinical research associate at Cambridge University, who is also an expert advisor to the government on COVID. Thank you very much for being with us. Are you comfortable with the lifting of almost all restrictions in a week's time?
Good afternoon. So I think today's decision was a very tough call for the government. But on balance, looking at the risks from lifting restrictions now versus the risks of lifting them later in relation to COVID, I actually think it does make sense. I mean, the main problem we will face if we don't lift restrictions now and we wait till later in the year is that it could actually put more pressure on the NHS. And that's something I've seen personally as a doctor on the front line, both in the first and second wave. That's the last thing we want. We're trying to avoid that. And we've got to the stage now, thankfully, through the very successful vaccination program, that the vast majority of people at high risk of hospitalization and death have had both doses. And so any further delay now is likely just to push those hospitalizations and deaths into the future. So as the Chief Medical Officer said last week, we've reached the point now where further delay, instead of actually preventing hospital admissions and deaths, just pushes them into the future. So on balance, but weighing all those things up, I think it is the right decision.
Yeah, as you say, it's a difficult call. He did say, the Health Secretary, that cases could get to 100,000 a day in the future. That could mean around 2,000 hospitalizations a day, which would be twice the normal hospitalization for respiratory diseases for the NHS. Is that some concern?
Of course it is, but as I said, the point is we could either have these 2,000 admissions now, or we could have them in October, November, December, January, February, when it's likely to be even worse because we have other respiratory infections which are also increasing. We have influenza, which is likely to be, or flu, which is likely to be worse this year. Unfortunately, the pressure that we're getting from other types of diseases, whether heart disease or other types of diseases, that will continue. And the backlog that's built up over the last 18 months, unfortunately, that's also going to continue. So it's really trying to find the optimum timing as to when it will produce the least harm. And it's not an easy decision, but the models that I've seen and those that are going to be released later today, I think will show that delaying things won't actually reduce the total number of hospitalizations and deaths. It will just postpone them. So this probably is the optimum time. The weather is on our side. Schools are on holiday. Fortunately, 90% of people, as we heard today, adults have antibodies. So our defenses are pretty much as strong as they're going to be, particularly in terms of reducing hospital admissions and deaths.
Right. And would you say that, if we needed to, this should be reversible and we should have to at some stage, reimpose or have the ability to reimpose restrictions? Or do you think this whole idea of irreversibility, if that's a word, is something that they should stick to?
I think, of course, none of us want to go backwards. I mean, we've had that experience over the last 18 months of restrictions having to come back in, and we certainly want to avoid that. And that's why I also welcome what was said today by the Health Secretary, that we must continue to be cautious. We must continue to wear masks in indoor, poorly ventilated areas, particularly in public transport like the tube, not to kind of pretend that everything is back to normal. It's certainly not back to normal. We're going to be living with COVID, unfortunately, for many months to come. Certainly, we'd expect to have this current level of kind of pressure on the NHS for many months. So it's very important that we do continue to be cautious. We don't go back to exactly how things were before, because they're not back to how they were before. You can still, and the vaccines are fantastic in preventing hospitalization and death. They're also very good in preventing infection, but they're not 100%. And so that's why the caution going forward still needs to be there. And that will make it less likely that we need to reimpose restrictions. I mean, it's not impossible. No one can predict the future exactly. But if we take things carefully, if we follow the guidance, it's no longer laws, but those guidances are there, for our own protection and for the protection of others. That will make it, much less likely that we'll have to go backwards.
Yeah. Would you have kept some sort of rules on masks specifically? We're releasing all the other social distancing and the capacity indoors and so forth, but keeping masks on public transport and in sort of crowded indoor spaces, would you have kept that as a rule rather than as a voluntary thing?
So personally, I would have for two reasons, really. One is, of course, that will slightly increase the proportion of people wearing them, although looking at the polls, it sounds like most people are going to continue wearing them anyway. But the second reason is to avoid kind of conflict. When it's a rule, then no one can kind of argue about the need to wear them. When it's guidance, we don't want to get into awkward situations where people, are arguing and fighting with each other over masks. And so, I hope Transport for London and other transport companies will make it a condition of carriage. So even though it's not a law, it's a requirement to wear face coverings on public transport, as it is, for example, you're not allowed to drink alcohol on the tube. So, Transport for London have that power to bring that rule back in. But the other point to make is, masks do have a role, but vaccination is by far the best protection. And there are parts of the country, for example, in London, where about a third of adults still haven't had their first dose. I would really encourage everybody, the best way you can protect yourself and for others, particularly young people, is by having the vaccine. That gives you by far the biggest share of the protection. Masks provide an additional protection as well, but nothing, not compared to the vaccine, which is a way of preventing infection, not just for yourself, but for others as well.
Yeah, and I gather, I think I read you're about to go back sort of working on the front line, or just have been. Are doctors, some I've spoken to are saying they are seeing more young people in hospital, and certainly seeing more young people with long COVID. Is that your experience?
So you're right. I certainly don't take COVID lightly. I've seen, sadly, colleagues and relatives die from COVID, and I've seen many cases over the last 18 months in hospital, including younger people, and some that even end up in intensive care. And the good news, as we heard today, is that vaccines have reduced the number of infections, hospitalization deaths by between 80 and 90%. So really, it's a huge change. And we are not in the same position that we were last winter when we had a similar number of cases. The proportion of cases that are going into hospital is much lower. The reason the ages are lower, of course, is because younger people, some of them haven't had a single dose, many have not had both doses, but that picture will improve over the coming weeks as people get their second doses. On long COVID, of course, it's a concern. And I saw very early cases of long COVID when I was on the wards last May. But again, you have to weigh up the potential harm from long COVID versus the potential harm from ongoing restrictions. And that's why I think on balance, now is the right time, to go forward with step 4. And of course, we keep this under review in the coming months. But hopefully, if everyone continues to be careful and continues to follow the guidance, we can reduce the risk of having to go backwards.
Okay, so just to sum up, you were backing the delay, I think, to the end of lockdown last time, but your view now is that basically this is the right time to do it, and that vaccinations and the success of the rollout means that we have our defense in place, as it were.
Correct. So the reason I backed the delay 4 weeks ago, and then you're right, I came on to Sky to explain why, was because I knew that in those 4 weeks we could give those additional millions of doses, as we have done, that would actually prevent those hospitalizations and deaths and many infections. So that was very much worthwhile. In schools, we're still, obviously children were still going to school over the last 4 weeks, and I wanted to minimize disruption to education. So I think it was right for the 4-week delay, but we're now, I hope, in the optimal time and place to move forward with step 4. And it was never going to be an easy decision. It's never exactly the right time, but I think this is the best time to go for it.
All right. Well, listen, Dr. Ali, very interesting. Thank you very much for being with us.
Thank you.
And